Thank you so much for joining the 2024 open enrollment meeting. My name's Rebecca Hawes, and we are going to discuss open enrollment and the different options that you have at this time for election purposes. The great news is that we're keeping almost all of the coverages exactly the same. Medical is going to be remaining with United Healthcare, dental, vision, voluntary life, those disability benefits, critical illness and accident plan, and your employee assistance program. The only provider vendor changes that we have this year are going to be your health savings account and your flexible spending account. We are moving away from WEX and will be transitioning over to TriNet. As a reminder, open enrollment will start on October 28th and go through November 7th. All benefits that you elect during open enrollment will be for an effective date of December 1st, 2024. Those benefits will remain in place until November 30th, 2025, unless you experience a qualifying life event. Reminder that open enrollment is that one time of year that you can make a change to your benefit elections. Maybe last year you were on a PPO copay plan for the medical, but now you want to join the high deductible health plan or vice versa. This is your one opportunity each year to make those types of changes. What happens if I have a qualifying life event during the year? If you have one of the events listed on the screen, this allows you to make a change to your benefits, but you must let your HR team know within 31 days of that event date. For example, marriage, birth or adoption of a child. If you or your dependents lose other coverages, these are all examples that would allow me to make a change to my benefits throughout the year. Who is eligible for this coverage? Your legally married spouse, your domestic partner, children under the age of 26, disabled dependents, and grandchildren whom you claim as a dependent for federal income tax purposes. Medical. Again, we are renewing with United Healthcare. We're continuing to offer 3 medical plans. You have the high deductible health plan, and you have the base or buy-up PPO plan. All 3 of these plans are remaining with United Healthcare, and they all utilize the same nationwide network called Choice Plus Network. All of these plans have in and out of network benefits. They all cover your preventative care at 100%, and they all include virtual visits, or another term would be telemedicine. Specifically on the PPO plans, we refer to those as the base or the buy-up plan. Those plans offer fixed dollar amounts or copays for office visits and prescription drugs. The PPO plans are also going to offer you a lower deductible. The high deductible health plan that's attached to the HSA or health savings account, all of your services go towards the deductible first. With that high deductible health plan, it allows you to make pre-tax contributions, or another term for that is tax-free contributions into your health savings account. Plus, you get free money from your employer contributed into your HSA. The high deductible health plan will have the lowest premium being deducted from your paycheck. Here's the medical plan comparison. I do want to focus on a couple of items. Things that are noted in a blue font are going to be changes that occur for the upcoming plan year effective December 1st, 2024. Let's focus first on this high deductible health plan. We were required to increase this deductible due to the HSA compliance. So this deductible has been bumped up to $3,500 per individual, $7,000 per family. Once I meet my $3,500 deductible, The plan picks up at 100% for the remainder of the calendar year. As a reminder, on a high deductible health plan, if I'm going in for a primary care office visit, you'll note it says 100% after deductible. I have to meet that $3,500 deductible first, and then the plan picks up at 100%. Same with my prescription drug coverage, 100% after deductible, so I'm paying $3,500 out of my pocket, and then my medications will be picked up at 100%. On the base and the buy-up PPO plan, your deductibles and out-of-pocket maximums have stayed exactly the same. Under both of these plans, there is a deductible that would come into play for anything outside of the office visit or outside of the pharmacy benefit. For example, if I'm going into the primary care physician doctor's office, if I'm under the age of 19, a dependent would pay $0 copay. If I am an adult going in for the flu, strep throat, whatever the case might be, I'd have a $25 copay. My deductible does not apply under this base and the buy-up plan under office visits. We encourage you to use the designated UHC specialist provider. It is just a smaller network within the large Choice Plus network. For specialists, that would be a $25 copay. If you use someone else within the large United Healthcare network, it's a $50 copay. Telehealth or virtual visits are covered at 100%. The deductible does not apply. And then as a reminder, that wellness is covered at 100%. Deductible does not apply. When we say wellness, we mean things like annual adult physicals, well woman exam, well baby child checkups, flu shots. These are all examples that would be covered at 100%, no out-of-pocket cost. You'll notice there's a couple of items here on the base PPO and buy-up that are in blue. They have increased that emergency room copay to $500 on both the base PPO and the buy-up plan. And they have also decreased down here at the bottom the urgent care copay to $50. We spoke about the deductible not applying on the base and the buy-up for office visits and prescription drugs. But you'll note here, for example, inpatient hospitalization. If I get hospitalized, my deductible will apply on both the base and the buy-up PPO. Just some tips and tricks to remember while we're thinking about the new plan year. If you're enrolled in that high deductible health plan, I encourage you to shop around for your medication. We would think that if I'm getting a prescription for an antibiotic or whatever the case might be, it would be the same cost at each pharmacy. But however, each pharmacy has a different contracted rate. United Healthcare has tools on the myuhc.com website that allows you to price and compare the different pharmacy pricing. Please check your explanation of benefits, also referred to as an EOB. If you're using an in-network doctor for covered services, you should never pay more than what your EOB states is your financial responsibility. Ask your physician for samples. If you are getting prescribed a new medication, you're not sure how it's going to interact with you, you can ask them for a sample. That gives you a little bit more time to go shop around and find which pharmacy has that drug at the cheapest price. Always encourage you to use urgent care, virtual visits, or after-hour clinics. It's going to save you a lot of money if it's not a life or limb-threatening event. If it is a life or limb-threatening event, please go to the nearest emergency room. And then just that reminder that preventative care is covered at 100%. We really encourage you to get those annual adult physicals, well women exams, and well baby child checkups. Virtual visits. Hopefully we all are used to virtual visits now. It's a great way to access a doctor via your mobile phone or computer without an appointment. You can access them at your house, on vacation, any place. Typically, the visits takes about 10 to 15 minutes. There is no copay on any of the three medical plans, and they're going to be able to treat you for some of those common conditions. Things like pink eye, sore throat, sinus infection. I've used the virtual visit several times. It works great. We've been on vacation, had a sick child. We were able to call in. That doctor was able to prescribe medication, and we could go pick up the medication at the local pharmacy. Want to give you a couple of medical claims examples just so you can think about which plan might be best for you and your family for the upcoming plan year. Here we have the three plans across the top: the high deductible HSA plan, the base PPO plan, and the buy-up PPO plan. This employee is what we would call an infrequent user. They go in for their annual preventative care exam. There's no cost regardless of which plan I'm on. They go in for a primary care office visit. I have to pay the appropriate office visit copay on the base and the buy-up. On the high deductible health plan, I haven't met my deductible yet, so I have to pay that $100 contracted rate between UHC and that provider. This particular employee is on a monthly maintenance prescription. That means they take this medication 365 days out of the year. So we've just multiplied that $20 contracted rate times 12 to come up with the $240 responsibility. On the base and the buy-up, it's the copay times 12 months. We've had an urgent care visit and a specialist visit. So we add up the total medical cost incurred. This is going to be what we paid out of our pocket, either in deductible, coinsurance, or office visit copays. Then we have to think, how much am I paying for this health insurance? This is employee only, so we take that into account, how much came out of my paycheck on an annualized basis. On the high deductible health plan, we do get $300 from our employer on the HSA, so we can offset our total medical cost incurred by that. On the base and the buy-up, we're just adding up these two rows. So you can see, if I had a magic crystal ball and I could look into the future, 2025 year, and see, what are my medical expenses going to be like? If this was me, the high deductible health plan is a great plan option for me. It saves me significant dollars out of my pocket. And the base PPO plan would be another great option. The next example is a worst case scenario. This means that this employee had an accident. They ended up in the emergency room and then were in the hospital for several weeks. They reached their out-of-pocket maximum. When I reach my out-of-pocket maximum in any given calendar year, everything's picked up at 100% for the remainder of that calendar year. So under this example, $3,500 is my out-of-pocket worst case scenario for the high deductible health plan. For the base PPO, it's $5,000, and for the buy-up PPO, it is $3,500. We take again into account how much came out of my paycheck, and then we add these two rows up. And of course, on the high deductible health plan, we were able to take that $300 from our employer. Again, we're just trying to give you a couple of examples so you can start thinking about which plan might be best for you and your family. This is the medical rates. You'll see these in the online enrollment process as well as through the benefit guide. These rates have changed very slightly. You've gotten a very small increase this year, and your employer has picked up the majority of the increase that you've had this year. We're going to talk about tax savings account. As a Volusion employee, you have the opportunity to save with some tax savings. If you're a high deductible health plan participant, you have the health savings account or the dependent care flexible spending account. If you're on the base PPO plan or the buy-up PPO plan, you have the healthcare flexible spending account or the dependent care FSA. This slide is really just meant to show you how you can save money by putting tax-free dollars into a tax savings account. You'll see that reduces how much federal and Social Security taxes you have to pay. So it allows you to have additional spendable income after your expenses. As a reminder, the health savings account is for those employees enrolled on the high deductible health plan. That health savings account is a personal bank account in your name that allows you to put tax-free dollars in for medical, dental, and vision expenses, not only for yourself, but also for any tax dependents. Any unused balances accumulate over time. There is no use it or lose it provision. Funds are available after your contributions are deposited into your account. So this is one of the only tax deferred accounts that gives you a triple tax advantage. The money you put in is tax free. Your HSA account grows tax free as you invest it. And then when you withdraw your money, as long as you're using it for eligible medical, dental, and vision expenses, it is tax free as well. Who qualifies for a health savings account? Again, you must be enrolled in that high deductible health plan. You cannot be covered by a non-qualified health plan, and this includes being covered by your spouse or Medicare, not claimed as a dependent on someone else's tax return, and you or your spouse cannot be participating in a traditional flexible spending account. Each year, the IRS gives us a new dollar limit that we can contribute into our health savings account. We've noted the 2024 maximum annual contribution as well as the 2025 maximum annual contribution. You also have the opportunity to enroll in a flexible spending account through TriNet. A flexible spending account is similar to a health savings account. You're able to put tax-free dollars into an FSA to pay for your eligible medical and dental and vision expenses. For the new plan year starting December 1st, 2024, you can put up to $3,200 into your healthcare FSA. However, this is a use it or lose it policy. Under a healthcare FSA, if I like to put $3,200 into my FSA and I don't use all of that for whatever reason, I forfeit those dollars. Legally, Volusion cannot reimburse you that money. There is a rollover feature that allows you to roll over $640 each year into the new plan year, but anything above that amount, you would have to forfeit. It's important to note that your dates of services must be incurred during the new plan year, so it must be a date of service from December 1st to 2024 to November 30th, 2025. If you're currently enrolled in your healthcare FSA, please be sure to check your balance and make sure that you're using those dollars before the end of the plan year because November 30th will be here very quickly. With the flexible spending account, it also has a component called the dependent care flexible spending account. Under the dependent care FSA, you can use this for eligible expenses that include daycare, after school care, preschool, summer care, not including overnight camp. You can contribute up to $5,000 as long as you and your spouse are working. Dental. Good news is there's no changes to the dental plan. Everything's staying exactly the same. You have a low plan to select from and a high plan. There's two big differences in between the low plan and the high plan. First, we're going to start off with the calendar year maximum. On the low plan, United Healthcare gives everyone $1,250 per person to be used for dental expenses. On the high plan, you have $2,000 to be used towards dental expenses. You'll also note there's a difference towards your deductible as well, 25 versus 50. As far as the coverage, preventative care is covered at 100% under both plans. Those basic care, things like fillings, are covered at 80% after you meet your deductible. And then major care, something like a crown, is going to be covered at 50% after you meet your deductible. If you being the employee, or your children need orthodontia, you need braces, you're going to want to select the high plan. There is orthodontia care under that high plan. It's covered at 50% up to a $2,000 lifetime maximum benefit. In regards to the out-of-network reimbursement, always encourage you to use an in-network dentist. This is especially important on the low plan. You need to be using an in-network dentist. If you use an out-of-network dentist, your potential to be balance billed is going to be greater. In this example, we'll show you preventative care charge. We always encourage you to go in for those semi-annual cleanings. Those are covered at 100% with the deductible waived. You'll see under this with the preventative care charge of $150 in or out of network. UHC is going to pay that dentist, if I'm going in network, $80, that contracted rate. That dentist cannot balance bill me. There is no out-of-pocket responsibility because I stayed in network. However, if I go out of network for that preventative care cleaning that's supposed to be picked up at 100%, UHC pays that dentist $125 of the usual and customary rate, and I'm going to get balance billed $25. If we're going in for something major like a crown, this balance billing amount is much greater. So we always encourage you to find an in-network provider. The dental rates have not changed. They're staying exactly the same. There's been no change to these rates. Vision. Vision, again, is staying with United Healthcare. There's no changes to these benefits. You still have a $10 eye exam, $25 for prescription drugs. You have a $130 frame allowance, and $125 contact lens allowance. Please note the frequencies. Eye exam every 12 months, lenses every 12 months, and frames every 24 months. If you haven't used this benefit, I encourage you to go use your vision benefits. For example, with the eye exam, if I use this benefit today, October 29th, I'll have to wait 12 months from today's date to get my next eye exam benefit. These rates are staying exactly the same. There's been no changes to these rates. Voluntary life. You have the option to select voluntary life insurance. If you currently have voluntary life insurance today through United Healthcare, that will just roll over to the new plan year if that's what you elect to have, is to continue that voluntary life insurance. If you are new to the voluntary life insurance and you're not a new hire, you will have to go through what we call evidence of insurability and complete some forms. Then United Healthcare will review to see if they're going to approve you for additional life insurance or not. Disability. You have the option to purchase voluntary short-term disability. Another term I like to use is income replacement. With short-term disability, your benefit is 60% of your earnings up to $2,000 per week. That elimination period is 14 days due to accident or sickness. And then the benefit duration could potentially be for 26 weeks. Please note there is a pre-existing condition limitation. So if you're new to this policy, that pre-ex would apply to you. If you've been treated for or provided prescription medication or had a consult with any provider for 12 months prior to December 1st, that specific condition would not be covered. Pregnancy is considered a pre-ex when it comes to short-term disability. All employees have the long-term disability. This is an employer-paid benefit. If you were to be out of work for 180 days, then you'd start receiving a benefit of 50% up to $7,000 per month. You potentially can have this benefit until Social Security normal retirement age. Employee Assistance Program, also referred to as an EAP. You have a great EAP through United Healthcare. You have up to 3 free counseling sessions per incident per issue per year. The EAP can help you with a variety of different things. Maybe you've lost a loved one. Maybe you have some stress or anxiety at home. Maybe you need some help with relationships. It might be legal or financial concerns. These are all examples of what the EAP can help you with. This is 100% employer paid, so there's no fee to this particular benefit. So I encourage you to take advantage of it if it could help you. Critical illness and accident plan. With the critical illness and accident, I like to just take a pause and let you know that these are not health insurance policies. These are cash benefit plans. This does not replace health insurance. With the critical illness as an employee, you have the coverage of $10,000. Your spouse would have coverage of $5,000 and children would be $2,500. Once you enroll in this plan, if you have one of these covered conditions while you're enrolled, then United Healthcare would provide you a cash benefit. For example, if I enrolled in this plan on December 1st, 2024, and let's say February 1st, 2025, I had a heart attack and I had signed up. I would submit my claim to United Healthcare and they would provide me a check for $10,000. I could use that check at my own discretion. Me personally, I'm going to help pay for my medical bills and I'm probably going to be out of work for a little bit, so help with some living expenses. But again, you can use that money however you'd like. The next plan again is the accident plan. You can enroll in this for you and your dependents. With the accident plan, we're just giving you a little sample of what it covers. There's a very long list of the different services. But if I have an accident and I get admitted to the hospital, I would get $1,000 from the accident plan. For the number of days that I'm confined into the hospital for that accident, they would pay me $250 per day. With both the accident and the critical illness plans, there is a wellness benefit of $50 per calendar year. So if you're going out and getting that annual adult physical, well woman exam, those things would qualify and allow you to get that wellness benefit of $50. We have both these coverages today at Volusion. So if you are enrolled and you have gotten that wellness exam done, I encourage you to submit a claim to United Healthcare and get your $50 benefit back. Please note the pre-existing condition limitations on the critical illness if you're interested in enrolling in this plan. If you have any questions, we have the Benefit Advocate Center available for you. You'll see our hours are 8 to 6 Central Time. We've provided you the toll-free number as well as the email address. These are just examples of things that we help employees with through the Benefit Advocate Center. Maybe you have a claim, you're not sure if you owe that amount to that doctor. Maybe you need help with an ID card or finding a provider. These are all examples of what the Benefit Advocate Center could help you with. This concludes the open enrollment meeting. Thank you so much for attending. We are going to include our email addresses. If you have any specific questions, please feel free to reach out to us.